Hi there. Welcome. Come on in. Time to get yourself very comfortable because I can see from this list here that we're going to be doing an awful lot of medical exams today. We're going to be starting with a comprehensive health questionnaire, followed by some baseline tests before we look at your reflexes, the thyroid and lymph nodes, the stomach, some sensation testing, an eye exam and eye test, an ear exam and ear test, and a beep test, and finally a cognitive assessment. How does that sound? I think it's nearly all of the tests that we offer. So what I'm going to do is I'm going to just quickly grab the questionnaire, and while I do, take a seat and get comfortable. Okay? Great. So are you ready to begin? Fantastic. If there are any questions you're not sure of or need to come back to later, that's absolutely fine. Just let me know and we can revisit, okay? Fantastic. So some easy questions to begin with then. Could I start, please, by taking your full name? Thank you. And your date of birth, please. And your marital status, please. Your occupation. And the name of your current doctor, please. Do you remember the date of your last physical exam? It doesn't have to be the full date. The month is absolutely fine. That's great. So looking at your health in the past now, any of the following childhood illnesses, so do you remember having any of these? So, measles, mumps, rubella, chickenpox, rheumatic fever, polio. Do you remember when you had, or if you've had, any immunisations as a child at all? Okay, that's great, thank you. Do you remember when you had your last eye exam? Okay. And have you ever had any surgeries at all? And if so, the details of those, please. Okay. And have you been in hospital for any other reason than surgery? And if so, can you remember those dates? Okay. Have you ever had a blood transfusion? And can you tell me if you have seen your regular doctor at any time in the last year? And if so, those reasons why you are visiting, please. Great. Okay, thank you. Turn the page in. Looking at your medical history now, can you tell me, please, if you have a history of any of the following? So, anemia. Any complications from anaesthetic? Any anxiety disorder at all? Problems with arthritis? Any asthma? Autoimmune problems? Any bladder problems? Any disease that causes bleeding problems? Any blood clots at all? Any kind of bowel disease? Any depression? Diabetes? Any growth or development disorders? Any hearing impairments? Any heart problems? Heart disease, heart pain, angina, anything like that? High blood pressure? High cholesterol? Has suffered with hives at all? Any kidney disease? Liver disease? Any lung or respiratory disease? Any kind of mental illness? Migraines? Osteoporosis? Any acid reflux, indigestion, things like that? Any seizures at all? Any severe allergies? Any problems with the brain? Any thyroid issues? Any ulcers? Any visual impairments? Anything else that is significant that would go on this form that I would need to know about? Okay. So next, I'm after a list of any prescribed drugs, any over-the-counter drugs that you take, and things like inhalers, vitamins, things like that. If you could list those for me, please. Okay. Going back to allergies, a list of any allergies that you have, the type of reaction that you have when you encounter that allergen, and anything you take for it, please. Okay. So now we're going to take a look and see your family history. And by family, I'm talking about parents, grandparents, siblings, and children. Okay? Great. So, is there any family history of anemia? Complications from anaesthetic? Arthritis? Any asthma in the family? Any bladder problems? Any diseases which cause bleeding? Any depression in the family? Diabetes? Any heart disease? Any instances of high blood pressure? Any high cholesterol? Any kidney disease? Any lung or respiratory disease? Any migraines at all? Any osteoporosis, any bone conditions? Any seizures or convulsions? Any severe allergies? Any problems with the brain at all? Any thyroid problems? Okay. And then, any heart disease before the age of 65 in a mother, grandmother, or sister? And any heart disease before the age of 55 in a father, grandfather, or brother? Fantastic. So next, we're going to take a look at lifestyle. Try and answer as honestly as you can. No judgment here, okay? So firstly, exercise. Do you exercise? And if so, how often? Okay. Thinking about your diet next. If you think about your salt intake, is it high, medium, or low? And thinking about your fat intake, high, medium, or low? Do you drink caffeinated products at all? Anything containing caffeine? I drink lots of caffeine. Do you take it in coffee, tea, or cola? And if so, how many cups or cans per day? Do you drink alcohol? What kinds of alcohol and how many units per week? Or glasses? Okay. Do you smoke tobacco at all? How many cigarettes, packs per day or per week? Or vaping? Okay. Do you currently use any recreational drugs at all? Okay. Thinking now about your mental health. Is stress a major problem for you? Do you ever feel depressed? Do you panic when you feel stressed? Do you cry frequently? Do you ever have trouble sleeping? Have you ever seen a counsellor? That's great. Thank you. Nearly there. Okay, so in terms of living arrangements, do you live on your own or with others? Have you ever fallen? Okay. How often do you go out in the sun? When the sun is available, how often do you go out in the sun? And how often do you sunburn? Bit of a random question in the middle here. How often do you wear your seatbelt? Occasionally, frequently, or always? Okay. Last page. So, tell me how you best learn new information. By verbal instructions, by written instructions, or being shown pictures. What's your preferred method of learning that new information? And your highest level of education, please. Do you understand English well? Okay. So, thinking about now and the very recent past, can you please tell me if you're currently experiencing any symptoms, either now or in the past, any of the following? So, any fever or chills? Feeling generally unwell? Feeling tired or fatigued? Any eye pain or redness in the eyes? Any eyesight problems at all? Sore throat or hoarseness at all? Any ringing in the ears? Any sinus problems? Any chest pain or palpitations? Any earache or loss of hearing? Fast or slow heartbeat at all? Cold hands or cold feet? Any muscular pain at all? Any swelling in your arms, legs or feet? Any shortness of breath, any wheezing at all? Any kind of cough or shortness of breath during an activity? Any difficulty breathing while you're lying down or sleeping? Any abdominal, any stomach pain at all? Any constipation? Any heartburn, indigestion, anything like that? Any joint swelling? Any back pain at all, either from standing, sitting, lying down, any kind of back pain? Any itching on the skin? Any kind of confusion? Any dizziness or fainting at all? Any limb weakness or difficulty in walking? Any numbness, any tingling at all? Any anxiety? Any swollen glands at all? In your neck, under your arms, anywhere like that? Any hair loss? Any sleep disturbances at all? That can be anything, yes. So, difficulty getting to sleep, difficulty staying asleep, or difficulty waking. Okay. And finally, anything else that you'd like me to add to this? Any of the symptoms you've been experiencing that you would like me to make a note of? Fantastic. Well, that is the rather comprehensive health history questionnaire all done. So what I'd like to do now is I'd like to move through and just start some of those baseline tests. We're talking things like temperature, blood pressure, things like that. We'll really get stuck in to some of these exams, okay? Fantastic. Follow me. Okay, so nice and relaxed. What we'll do now is we'll take these baseline readings. I'll be making notes on the clipboard as we go. If you have any questions, please let me know. And as always, once we get started, if you need to take a break, if you'd like to stop, just tell me, raise your hand, anything like that, and we can take a pause or we can stop altogether. Okay? Great. What I'm going to do to begin with is put on a pair of gloves, okay? And then we will start by taking your temperature. Feeling well in yourself today, yes? Okay, good. If there are any of these tests that you haven't done before, or you'd like any more information, please just tell me, okay? So I'd like to start by taking your temperature. This just goes under the tongue. Just wait until it beeps, okay? So, open wide for me. Here we go. Thank you. That's great. That's normal. No fever today. Next, I'd like to measure the oxygen saturation in your blood. It's going to be done with this little machine here. All we do is pop it on your finger, like so, and once again we wait for the beep, okay? So, a finger on this hand. Thank you. Okay, here we go. That's it. Just hold that still for me. That's it. Perfect. Taking that back off again. Thank you very much. That's great. Another good reading. Okay. Next, I'd like to have a little listen to your chest with my stethoscope. Is that okay? Fantastic. Thank you very much. What I'm going to do is have a listen to your chest and then round each side and around the back to listen to your lungs as well. Is that okay? Great. This will be a little cold to begin with, but it will soon warm up, okay? Great, okay, here we go. Ready? Great, so, little cold to begin with. Okay. That's great. And then round the side. Okay. Ready? Okay, here we go. That's great. Same on this side. Okay, ready? Here we go. That's fantastic. And now just around the back, okay? Okay, here I go. Just feeling. There we go, on the back for those lungs, the sound of those That's fantastic. All done. Thank you very much. Sorry if that was a little cold and uncomfortable. There we go. Next, a blood pressure reading. What I'll do is I will be putting this cuff onto your arm. I will then be inflating the cuff, having a listen through the stethoscope as the cuff deflates. All you have to do is just sit there, okay? Great. So is this arm okay? Fantastic. That's great. So, this arm. Thank you. So. Okay. I'm going to inflate the cuff, okay? Ready? Okay. Great, and then just have a listen. Put that under the cuff. Just as that deflates, okay? Fantastic. I'll take this off. That's it. Slide your arm out for me. That's great, thank you. Was that okay? Fantastic. Okay. What I'd like to do next is just take a look at some of those reflexes on the inside of your arms and on your knees. Is that okay? Great. For the inside of your arms, I'll be using this reflex hammer, and for your knees, I'll be using this one. Okay? Yep, all you need to do, pop your arms out for me one at a time. We'll give this one a little rest. Start with this arm, okay? Great. So, if you could just rest your arm into my hand, please. Okay. 2 knocks on the inside of your arm, okay? Ready? Okay. Good, and again. Fantastic. One more time for me. Great. Thank you very much. And then this arm next, okay? Same thing again. Put your arm into my hand for me. Great. 2 taps on the inside of that arm. Ready? Okay, here we go. Good. And again, please. Fantastic. One more time. Yeah, wonderful. Put your arm back. And this one, what I'm going to do is just knock on your knee. Okay? So, this side first. Are you ready? Okay, here we go. Good, one more time for me, please. Yeah, that's great. And then on this side, same thing again. 2 taps. Ready? Okay, here we go. That's great. One more time for me, please. Yeah, fantastic. Thank you very much. Take a moment to relax. Okay. What I'm going to do next is this pointy end. It's not sharp, just a little pointy. To run it down those arms and those legs, followed by the rubber part of the hammer. I just need you to tell me that you can feel them, okay? Great, so this arm first, please. Ready? Here we go. Okay, and again. How's that? Great. This arm next, please. Okay, ready? Good, and again. Fantastic. Legs this time. Ready? Good, and again. Fantastic. And on this side. Ready? Good, one more time. How's that? Great. Now at this end. This side first, ready? Okay, here we go. Good, one more time. Fantastic. And on this side. Ready? Okay. And again. Wonderful. This leg. Ready? And again. Good. And this side. Ready? One more time. Good. How was that sensation-wise? Feel the same? Both legs, both arms. Feel the pointy end and the rubber end. Great. Okay. What I'd like to do next is I would like you to touch your nose and then touch my finger, please. So, nose to my finger, nose to my finger. Okay? What we'll do is we'll try it first and then we'll do it a few times after that, okay? Great, so begin by touching your nose, then touch my finger. Fantastic. Touch your nose, and then touch my finger. Great, so let's do that a few times. It won't be too fast, but we'll keep it going, okay? Fantastic, so touch your nose, touch my finger, 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 good, touch your nose, touch my finger, very good, touch your nose, touch my finger, good, touch your nose, touch my finger, good, couple more, touch your nose, touch my finger, good, touch your nose, touch my finger, touch your nose, touch my finger. Well done, well done. How was that? Easy, difficult? Great. So all those reflexes looked at. Next, I'd like to take a little look at the thyroid and lymph nodes, if that's okay. Fantastic. I'd like to begin by taking the pulse on each wrist, okay? Great. This one first. Okay, ready? Just breathe normally and relax. Okay, here we go. That's great, thank you. And again on this side, just going to, on the wrist, yeah, okay, ready? Here we go. Just feeling for that pulse, having a little count. That's great, thank you very much. Right. Next, I'd like to take a good look at your neck, please. So, you could just look up for me with your chin. That's it. Fantastic. Not so that it's uncomfortable, as comfortable as it is for you. And back towards me. Take a look over that way for me. Wonderful. And a look over that way. That's great, thank you. All looks absolutely fine. Okay. What I'd like you to do next is take a small drink of water for me. It'll be good after all that talking you've done with the questionnaire, things like that. To start with, I'd like to just watch as you drink. A little odd, I know, but I'm watching that swallowing motion. And then what I'd like to do is just gently feel around that throat while you're drinking. Is that okay? Great. So I have a glass of water here. Okay. There you go. And what I'd like you to do when you're ready is just to start drinking for me, okay? That's great. If you take another drink for me, what I'm going to do is just come underneath your arms, just be feeling gently around your throat. You should be able to drink quite normally. Okay, ready? Yep, when you're ready. Thank you, is that okay? I'll take that. Thank you. Other than feeling a little odd, how was that? Was that okay? Great. Great. I'd like to take a look at your tongue now and to the back of your throat. I'm just going to use this little tongue depressor. So when you stick out your tongue, just be using this to gently press down so it's out of the way. Okay? So stick that tongue out for me when you're ready, please. Fantastic. Okay, here we go. Looking around the mouth and to the back of the throat. That's all great. Thank you very much. Next, I'd like to take a really good look at that throat. I'd like to feel around the glands, front of the throat, round to the back, and that windpipe if possible. Is that all right? Great. If at any point you'd like a break or you'd like me to stop, then please just let me know, okay? Okay, here we go. So just to begin with, just feeling those glands in the neck. And then down the neck on each side. Then around the back. Looking for everything to be feeling normal. Around the front again, under the chin, and then just the windpipe. I'm just going to gently feel that windpipe. Okay, ready? Okay, here we go. Perfect. Thank you. I appreciate that probably wasn't the most comfortable, but tell me, was there any discomfort or pain at all? Okay. The last thing I'd like to do whilst looking at this is I want to just tap on your chest just here. I won't be tapping directly, I'll be tapping on my fingers just like so, but just at the bottom here. Is that okay? Fantastic. Ready? Okay, here we go. Thank you, and again. One more time. Fantastic. Was that okay? Any pain or discomfort there at all? Next, if you could just put your arms out for me, what I'm going to do, just feel those glands under your arms, okay? It will be firm enough so it doesn't tickle, okay? Great, so arms out for me, please. Thank you. Ready? It's all great, thank you. If you'd like to put your arms back down, all feels absolutely fine. And then finally, before we move back up to the face, just like to check out that stomach area, sort of gastrointestinal part of this exam. So we'll just be feeling around your stomach and around the sides. Is that okay? Okay. Any problems, pain, discomfort, as usual, please let me know and we'll stop, okay? Fantastic. Okay, here we go. Just checking for any sort of tenderness, that everything feels okay, that we can feel what we expect to feel. It's coming around the front now. Any pain, tenderness, anything like that at all? Okay. Good. No problems at all? Fantastic. That's great. So that's this part all done. What we're going to be doing next is we're going to be concentrating more on the face and the head. So what we'll be doing next is some sensation testing before we test your eyes and your ears, and then finally looking at a little cognitive testing. Okay? So we're going to move through once again to where we have all of the equipment ready for a very comprehensive eye exam and ear exam. Okay? Good time to take a little break. You can have some more water if you'd like to. Do you have any questions for me at this point in the exams? Okay, well, if anything occurs to you, please ask me as we go, okay? So through this way, and we'll start by taking a look at that face. Okay, so what we're going to do next is some sensation testing around your face, okay? What I'd like to do first is just change my gloves, if that's okay, just to a fresh pair, as I'm going to be touching around your face, okay? And then after this, that's it for the gloves once I've looked in your ears. So as I said, what I'd like to do first, if I may, is just have a feel around your face to see how everything feels, and I'd like you to let me know if there's anywhere that doesn't feel the same as I'm touching around, anywhere where the sensation is different. Is that okay? Okay, here we go. So, forehead to begin with. How does that feel? Okay. Coming down now onto those temples. Down onto the cheeks. Down your nose. And to your chin. And your jaw. How does that feel? Okay? Anything feel different, out of the ordinary at all? Okay. What I'd like to do next is ask you to close your eyes in a moment. What I'm going to do is touch parts of your face with these. So firstly, some cotton, and secondly this, which is very, very soft. It's goose feather. So I will be touching parts of your face, and you just need to tell me if you can feel it, okay? Great. So this one first, the larger of the two. So close those eyes for me, please. And tell me when you can feel it. Ready? Okay, here we go. Good. Fantastic. Very good. That's great. And again. Great. And again. A couple more. Last one. Okay, open those eyes. How was that? Okay, good. Anything feel any different at all? All good? Great. So the same again, just with the softer, smaller goose feathers. Okay, ready? Close those eyes again for me. Okay, here we go. Good. 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 Well done. Good, a couple more. Well done, last one. Great. Open those eyes for me. Yep, good. So how was that? The larger one, the smaller one? It all felt the same across the face. Great. Okay. Next, what I'd like to do is, I have 2 cotton balls here. One is wet and one is dry. I'm going to ask you to close your eyes again, and I'd like you to tell me whether the one that's touching your face is wet or dry. Is that okay? Fantastic. So, eyes closed for me, please. And all I need to know is wet or dry. Ready? Okay, here we go. Good. Well done. Yes. Good. Well done. A couple more. Good. Last one. Okay, open those eyes. So how was that? Easy to tell the difference between wet or dry? Great. So, I'll take this dry one and just, you can keep your eyes open, just making sure where that wet touched, it's dry. Okay. Great. Continuing on with that theme, I have these. And of these, one is warm and one is cold. So one is sort of room temperature and one has been in the freezer. And all I need you to tell me is if it's a warm sensation or a cold sensation. Is that okay? Great. So once again, close those eyes for me, please. Okay, and all I need to know is warm or cold. Ready? Okay, here we go. Good. Yes, well done. Good. Yes, very good. A couple more. Last one. That's great. Eyes open. How was that? Any problems with the sensations of warm or cold at all? Yeah, that's great. Next, back to this fabulous goose feather. I want you to tell me if it is the soft end or the pointy end which is touching your face. There's no actual point on there, but I'm looking to see if you can tell the difference between the feather and the wooden end. Okay? Great. Any problems, please let me know. We can stop. So close those eyes again for me. So feather end or wooden end. Ready? Here we go. Good. And again. Well done. And again. Good. And again. Well done. Ready? Good. A couple more. Good. Last one. Okay, open those eyes. How was that? Any problems telling the difference between the soft and the less soft? Okay. And finally, before we move on to scent and taste, what I'd like to do is I would like you to tell the difference between metal and wood for me, just to see which is touching your face. So again, these are just the tweezers again. This is just a flat metal edge and a flat wooden edge. Eyes closed for me. Ready? So metal or wood? Good. Good. Well done. Good, a couple more. Good. Last one. Fantastic. That's great. So eyes open, give those a good blink for me. How was that? Any problems telling between the metal and the wood? Great. Okay. So next, I have here 3 bottles of scent. And all I would like you to do is smell them and tell me what scent it is. Is that okay? Fantastic. They are all 3 very common smells, so there shouldn't be a problem in you knowing what the smell is. We're just seeing if your sense of smell is good, okay? Fantastic. So, bottle number 1. Okay, so what I'm going to do is just wave it under your nose. Just breathe in through your nose. No need to breathe in particularly deeply. And tell me what this scent is. Are you ready? Okay, here we go. How was that? What was that scent? Yes, that's right, well done. So that's the first one. Ready for the second? Just take a couple of deep breaths in to clear out any scent that's already in there. second one. Ready? Okay, here we go. Just breathing through the nose for me. How about this time? What scent is that? Yes, that's right. Third and final scent. See if we can get 3 for 3. A couple of deep breaths in through the nose again. Okay. So, just breathing through the nose for me. Ready? Here we go. What scent was that? Yes, 3 for 3. Well done. Again, a couple of deep breaths through the nose. Fantastic. So finally, before we move on to your eyes, I'd like you to just taste one or two things for me. What I'm going to do is some of these little sponges, and on the end is a flavour. And all you need to do is tell me what flavour it is you can taste. Is that okay? Great. I have 3 to show you. Great. So, are you ready? Okay. So, open wide for me. I'm just going to pop this on your tongue. Okay. Here we go. What flavour is that? What does that taste like? Yes, that's right. Well done. I've got 2 more. Is that okay? Great. So here's the next. So, open wide again for me. Here we go. Let's roll that around on the tongue. And again, tell me, what flavour is that? What can you taste? Very good. Shall we try again? 3 for 3. Okay. Last one. Open wide for me. Thank you. Here we go. So finally, what did that taste of? What flavour? Great. Well done. There is a glass of water just there if you'd like to just cleanse the palate after those flavours. Any further comments about the scents, your sense of smell, the flavours, the taste, anything you'd like me to know outside of these results here? Okay, good. So, I'd like to move on to your eyes now. It's going to be quite a comprehensive test because there are lots of things to do. It's going to involve your eyes following things, bright lights in and around your eyes. There will be some eye charts for you to look at and some colour blindness test charts as well. So all sorts to look at. Is that okay? Great. What I'm going to do, I'm just going to take off my stethoscope because I won't be needing that anymore. Pop that there. And again, we'll just change these gloves because I've been touching scent bottles and taste sponges, things like that. So, new set of gloves. Grab these. It's out the way. Any comments for me about your eyes before we begin? Okay. So not that long since you had your last eye test. No problems there at all. Great. Okay. So what I'd like to do first is just have a feel around your eyebrows, just sort of like this, and then a very gentle feel around your closed eyes. Is that all right? There won't really be any pressure, as I say, just gently feeling around those eyelids and around the top here. Is that okay? Great. I'll start with your eyebrows. I'll do them both together. If you'd like to close your eyes for this, that's absolutely fine. Ready? Okay, here we go. Just gently squeezing those brows. That's all great. So next, if you could close your eyes for me, I'm just going to feel across those eyes, okay? Great, eyes closed. Okay, here we go. Okay, just keeping those eyes closed for me, I'm just going to have a look around with a little light and a magnifier just to look at those lashes and eyelids. Okay, here we go. Okay, open those eyes up for me. Any problems there at all? Any pain, any discomfort while I was touching on or around the eyes? Okay. Next, if you could just blink a few times for me. That's great. And then scrunch your eyes up really tightly for me, please. Really tightly. And open them. Good. Okay. Last time of touching your eyes, what I'd like you to do is close your eyes for me. And just with my fingers, I'm going to try and just gently open them. Okay? Again, any pain or discomfort, let me know and I'll stop. So, close those eyes for me. Okay, here we go. Ready? That's great. Open those eyes again. Give them a good blink. like you to look at me, and I'm going to be wiggling my fingers all over the place. I just need you to tell me when you can see my finger. Okay, so looking at me, and you'll see my fingers appearing in the edges of your vision. Okay? Great, so looking at me, straight ahead. Here we go. Good. Good, well done. Very good. Yes, a couple more. Good. Last one. Good. Any problems seeing those at all? Okay. Along similar lines, what I'm going to do is move my fingers, and you just need to tell me when you can't see them anymore. So, still looking at me, I'm going to move my hands. Just tell me when they're gone, okay? So, ready? Okay, here we go. Good, and again. That's great. This way this time. Fantastic, and again. Good. This way now, ready? Good. And then this way, final time. Good. Any problems there at all? Okay. I apologise for that dog barking. Good job it's not the hearing part of the test. Next, still looking at me, what I'm going to do is hold up some fingers. And you just need to tell me how many fingers you can see whilst looking at me, okay? Great. So, ready? Okay, here we go. Good. Very good. Good. Well done. Good. Good. Yes, well done. A couple more. Good. Well done. Any problems there at all seeing the fingers, identifying the numbers? Great. Same thing again, but what I would like you to do this time is close your left eye for me. So put your hand over if you like, and then what I'm going to do is again hold up some fingers, and you need to tell me what you can see in your peripheral vision, okay? Great. So cover that left eye for me. Great. So, looking at me, how many fingers? Good. Good. Well done. Yes. Good. Couple more. Yes. Good. Uncover that left eye and cover your right eye for me, please. Same thing again. How many fingers? Ready? Here we go. Good. Good. Yes, well done. Good. Very good. Yes, a couple more. Yeah, last one. Good. Uncover both those eyes. Any problems there at all? Okay. I'd like to take a look into the back of those eyes, and I'll be using this to do it. There's a bright light, which I'll show you. Ready? It's like this. But I need you to look ahead. So rather than looking into the light, try and look past it. And I'll just be looking into the backs of those eyes. Okay? So, this side first. Ready? Okay, here we go. That's great. And into the back of this eye. Ready? Okay, same again, here we go. That's great. Give those eyes a blink. Get rid of any dazzling. That looks fine. Next, I'd like you to be looking forwards again. Another light. I'm going to be shining it into each eye. So, I'll show you the brightness of the light again. Ready? So it's this bright, so quite a bit brighter. But again, just looking over my shoulders. Okay? Great. So, we'll shine it into one eye at a time. Okay? Looking ahead, here we go. Ready? Okay. Good. Keep looking ahead. And again, still ahead for me. Very good, well done. So, this side now. Looking ahead. Good, well done. Fantastic, one more time. Good. Give that a blink. Next, I'm going to bring the light towards you and then away from you. And I'd like you to follow the light this time, please. Okay? So, bright light again. Ready? So, coming towards you. Good. And away from you. Towards you. And away from you. One more time, towards you, and away from you. Okay, quick blink. So this time looking over my shoulders again, I will be swinging the light in and out. Okay, this eye first. Ready? Okay, here we go. Good. Well done. Fantastic. And the other eye, just looking ahead. Good. Well done. Fantastic. Another blink to just clear that dazzling. Next, what I would like you to do is cover your left eye. And what I'm going to do is bring the light in, tell me when you can see it, and then I'm going to take the light out. You just need to tell me when it's gone again. Okay? So left eye covered. Great. Ready? Okay, here we go. Good. That's great. One more time for me. Good. Fantastic. So, uncover that left eye, cover up the right eye for me, and we'll do the same again. Okay, so tell me when you can see the light, and then when it's gone again. Ready? Okay. Good. Well done, one more time. Good. Uncover those eyes. Any problems there at all? Next, much like I did with my fingers, I'm just going to do the same thing with the light, just in different areas, okay? Just tell me when you can see the light, okay? So, looking ahead for me. Okay, here we go. Good. Good. Well done. Good. 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 Well done. A couple more. Good. Yes. Last one. Good, well done. Any problems seeing any of those at all? Okay. What I'm going to do next is bring back the smaller light as well as the larger light. Just show you them both again. Ready? Like this. What I would like you to do is with your eyes follow the smaller light. Okay, ready? Just follow that smaller light. Here we go. Good. Well done. Following that smaller light. Very good. Keep following for me. Almost there. Good. Well done. Again, give it a good blink. Next, 2 larger lights. One is a regular light, I'll show you now, ready? And one is a UV light, so it's purple, ready? What I'd like you to tell me is, when the lights show up down here, whether it is the yellow light, regular light, or the purple light, so yellow or purple. Okay, so looking at me, ready? Okay, here we go. Good. Yes, well done. Good. Well done, and again. Yeah. One more time. Good. Well done. Any problems there at all? Great. Page over. Okay. So what I'd like you to do is close your eyes for me now. Switch off some of these torches. And with your eyes closed, I would like you to tell me if I'm shining the pen light on the left eye or the right eye. Okay, so close those eyes for me. So left eye or right eye. Ready? Okay, here we go. Good. Left eye or right eye? Good. Left eye or right eye? Good. Left eye or right eye? Good. Couple more. Left eye or right eye? Good. Last time. Left eye or right eye? Good. You can open those eyes back up for me. Fantastic. Any problems there telling which side the light was shining on? Great. So before we move on to the eye charts themselves, I'd just like to have a little look at how those pupils react to a sudden burst of light. So what I'm going to do is use these to cover up your eyes. Once they're covered, I'll uncover them so the light can flood in, and we'll take a look at what those pupils do. We'll do that 2 or 3 times. Is that okay? Great. So, first time, just so you can get used to the sensation. Ready? Okay, here we go. Is that okay? Great. So, second time, ready? Okay, here we go. Great. Last time. How's that? Okay. Great. Other than it being a bit bright, any problems there with the light coming into the eyes? Okay. I'm going to show you some eye charts now. I have 3 to show you that are all slightly different. So firstly, you're most likely to be familiar with this one. This is the kind of eye chart that you would see during a regular eye test with lots of letters. The next one has numbers which get very small very quickly. And the last one has text for you to read, so you can be taking a look at that and reading the text. Is that okay? Great. So what I'd like you to do first for me is just take a look at this chart for me and read. Let's pop it over here. Just the first 3 lines for me. Great. And again on this side, please. Those first 3 lines. Fantastic. Can you read the 4th and 5th line for me at all? That's great, thank you. What I'd like to do, just quickly, just pop one of these lenses over your eyes. I'd like you to try and just read this again for me. Is that okay? Yeah. Okay, so here come the lenses. Ready? Fantastic. Just read that 4th and 5th line again for me. Thank you. Just one more time with a different set of lenses. It's okay, it's quite comfortable. Okay, here we go. Okay. That 4th and 5th line for me again. Wonderful. Okay, thank you. So tell me, those smaller lines, 4th and 5th line, was it easier with no lenses, or the first set, or the second set? Okay. Let's make a note of that. Same again, but with the numbers. Just the top line for me, please. Good. And then, again, with the lenses, just the second line for me. Ready? Okay, here come the lenses. That second line for me. Good. And again with these lenses. That third line for me, please. Good. Well done, thank you. So tell me once again, reading those numbers, did they look clearer without the lenses, or the first set, or the second set? the eye chart with the text, I'd like you to look at the largest text at the bottom. Just have a little read for me. Let's pop that in the middle for you. Great. Again with the first set of lenses. Ready? So, have a read. Let me hold that a little better. Have a read of that second paragraph up for me. That's great. And then again with these lenses. Ready? Again, just reading, apologies, that second paragraph up for me. That's great. Thank you very much. If the story interested you, you can read the entire chart afterwards if you'd like. So with the text, which was the clearest, without any lenses, or the first or the second? Fantastic. Before we carry on to the colourblind testing, I'd just like to take a measurement of your eyes, if possible. Just using these sliders here, just to get a very good measurement. Is that okay? Yeah, it won't touch your eyes. Okay, here we go. That's fantastic. Thank you very much. Great. So the final test for those eyes. I'm going to show you some pictures. All these pictures have different coloured dots in them, and I simply need you to tell me what number, if any, you can see in those dots. If you can't see a number, that's absolutely fine. Just tell me that you can't see one and we'll move on. If you can see the number, let me know what it is. If you're not sure, take a guess. Okay, ready? So, here we go. Tell me, what number can you see? Good. And again, tell me, what number can you see? Very good. And again, what number can you see? Okay. Next number, or next picture, sorry. What number can you see? Good. And again, what number can you see? A couple more. What number can you see? And finally, this one here. what number can you see? Great. Any problems with any of those numbers, any of the dots, any of the colours, any problems at all? Okay. So before we move on from your eyes to your ears, are there any observations you would like to make about those tests that we've just done? Anything you'd like to tell me, you'd like me to add to my notes, anything you found a bit surprising, a little different to what you were expecting, anything you'd like me to include in my report? Okay. Fantastic. So what I'm going to do is move all of the equipment for your eyes out of the way and bring in all of the equipment that we're going to need for your ears. What we're going to do is a few tests of your hearing. We're going to use some sounds, some tuning forks, things like that, and then we'll move on to a beep test after that, okay? Great. Let me swap all this equipment over and I'll be right back. Okay, so next we're going to take a look at your ears. I'm going to start by having a good look around the outside and a little look on the inside, just to check for any inflammation or wax buildup, anything like that, and then we're going to test that hearing. Firstly by saying some words, which you'll need to repeat back, and then by whispering words, some word pairs, and finally having a little listen to some tuning forks. After that, we'll move to the headphones and computer for a beep test, okay? Then after that, it's just the cognitive screening to go. So how does that sound? Okay, great. What I'd like to do is start by just taking a look around the outside of your ears with this little light here we've been using. And I'm just going to take a look. See, I've had a feel before now. Just take a look just to see that everything is as it should be, okay? This ear first, you ready? Okay, great, here we go. So as I say, just looking for anything that jumps out as perhaps looking a little different. But everything looks as it should, certainly, with that ear. I mean, all ears look different. This side next, ready? Okay, here we go. So, same again. Just looking around the outside and backs of those ears, and then around the inside of the ear without going into that ear canal. Yep, once again, that all looks absolutely fine. What I'm going to do next is have a look inside the ears. So, just with the otoscope, there's a light at this end, and I'll just be having a little look, see if there's any redness in there, any swelling, anything like that, that might stop you from being able to hear properly, just to ensure that we can get the best results from these tests, okay? Great. So what I'll do is I'll take a look in this side first. Any pain, any discomfort, anything like that, please just let me know and we can pause or we can stop, okay? here we go. Ready? Okay. So firstly, just taking a look in here, looking around to see that everything is clear, which it is, and that is absolutely fine. And then what we'll do is we'll do the same in this ear. Ready? Okay, great, here we go. So once again, just taking a look to ensure everything is perfectly clear so we can get those good results on the hearing test. Two shiny eardrums. Was everything okay? Any discomfort at all? Everything sounding all right? Okay. Right. One more time for me. I know we've done this once before. I'd like you to turn your head for me. So, begin by turning it to the left, back to the centre, and then right, and back to the centre. Only as far as is comfortable, okay? So, turn to the left for me, back to the centre, looking to the right for me, back to the centre, one more time, to the left for me, back to centre, to the right, back to centre. How was that? Any pain or discomfort there at all? What I'm going to do now is click my fingers, and I'd like you to tell me how that sound is going into the ears. Is it sounding the same on both sides? Okay, so listening carefully. How did that sound? Okay. So next, if you could close your eyes for me and then tell me if the sound is coming from the right or the left. Eyes closed. Okay, here we go. Ready? Which side is the sound coming from? Good. Which side is the sound coming from? Well done. And again. Good. Which side? Fantastic. A couple more. Which side is the sound coming from? Fantastic. One more time. Which side is the sound coming from? Good. Well done. Any problems hearing on either side at all? Okay. Take these gloves off. We're done with the gloves. Lots of pairs of gloves today. Keeping you all nice and safe. So what I'm going to do now is read out some words, and all I'd like you to do is tell them back to me. So whatever word you hear, okay? Some are designed to be tricky because they're being read quietly. So if you can't hear, then just say don't know. That's absolutely fine, and we'll move on. Okay, so are you ready? Great. So your first word is home. Your next word is tip. The next word is reach. Next is pair. Your next word is door. Following that is said. Your next word is moon. Following that is dime. After that, it's fall. Good. Your next word is pick. And after that is the word lot. Your next word is jar. Following that, your penultimate word is third. And finally for this list, take. Fantastic. Next, I'm going to read you some pairs of words, but this time I'm going to cover my mouth, okay? And I need you to tell me which pair of words you heard, okay? Great. So, your first pair of words are glove, dove. Would you like to hear those again? Okay. Glove, dove. Your next pair of words are air, care. Air, care. The next pair, well, tell. Well, tell. Your next pair, burn, turn. Burn, turn. And your final word pairing, cat, mat. Cat, mat. Fantastic. Next, I'm going to whisper some words, so getting trickier each time. And all I need you to do, again, is tell me the word that you heard. You don't need to whisper it back, you can speak it back. And once again, if you're unsure or you don't know, then just say don't know, that's absolutely fine. Okay? Great. So, your first word is Your next word is week. Good. Followed by when. Your next word is south. Good. Your next word is such. Good. Following that is near. After that, rush. Good. After that is make. Well done. The next word is have. Following that is good. Next is back. And finally, the word chief. Good. Finally, for this part of the hearing test, what I'd like to do is just play a couple of tuning forks into your ears. Have you listened to tuning forks before? Okay, both of these are low frequency, so there won't be any high-pitched sounds coming towards you. This one is the lower of the frequencies, and I'll play this for you second. We're going to go first with this one, and all I need you to do is take a listen and tell me how it sounds in each ear. Okay? Great, so this ear first. Ready? Here we go. And again. Okay. Okay. And this side, ready? Here we go. One more time, ready? Ooh. Try it again, sorry. So how was that? Did you hear it well in each ear? And how was the sound in each ear? Was it similar? Was one softer than the other? Was it a similar volume? Okay. What we'll do now is we'll listen to this one, and this one is a much lower frequency. Again, we'll do it twice in each ear, okay? This ear first again. Ready? Okay, here we go. How was that? Okay, one more time. And then the same again in this ear. Ready? more time. How was that? Was the sound, again, the same in both ears? Could you hear it well? And how was it in comparison to the other tuning fork, the slightly higher frequency? Did they sound similar? Were you able to pick up on them the same, or was one easier to pick up on than the others? Okay. So, do you have any comments or questions for me about this section of the hearing test? Anything that you would like me to add to my notes? Anything that you would like me to include? Anything that sounded a little bit different, a little bit off to you at all? Okay, no problem. Fantastic. So what we're going to do next is we're going to give you some headphones which are attached to the computer, and we'll be doing what's called a beep test, and I'll explain that to you as we go. So what I'll do is I'll get all of the equipment ready and we'll take it from there. Okay, here we go. Okay, so here's how the beep test works. What I'm going to do is start by putting some headphones on you. And once they're comfortable over each ear, what will happen is, rather than hearing me as you hear me now, you'll hear me through the microphone on the computer. What will happen then is I will play you a series of beeps through the headphones. And what will happen is sometimes they will be in both ears, sometimes in the left ear, sometimes in the right ear, and all different frequencies, but nothing too high. They're all in the low range. That's what we're interested in looking at today, okay? As with all of these tests, if there are any problems, if there's any discomfort, any pain, or you simply need to take a break or stop, then please let me know and we can do that with no problem, okay? Great, so are you ready to give this a try? Fantastic. So let's start by putting on these headphones. Once I've put them on, get them nice and comfortable, and you'll start to hear me through the computer's microphone, okay? Great, here we go, ready?
Fantastic. So what I'm going to do to start with is I'm going to play the beeps into both ears at the same time, okay? All you need to do is let me know when you can hear the beeps. Give me a nod, give me a wave, say yes, anything like that, okay? Fantastic. Here come the first beeps. Yes, well done. Was that okay? Great. Then we'll carry on with some more. Ready? done. What I'm going to do this time is I'm going to play the beeps into the left ear. So you won't hear anything in the right. There's some noise cancelling in the right. Just that left ear. Ready? Here we go. Good, well done. Yes, that's great. Good, well done. Couple more. Yes, last time. Good, well done. How was that? Was that okay? Fantastic. So same again, but this time on the right. So there will be noise cancelling in the left this time, and all the beeps will come on the right, okay? Great. Ready? Here we go. Good, well done. Yes, that's right. Well done. Good. A couple more. Well done last time. Yep, fantastic. How was that in each ear? Similar volume, similar sounds? Yeah, they were the same sounds but in each ear? Okay, great. So what's going to happen this time is the sounds are going to be in both ears again, but different frequencies this time. So even though they're the same volume, they may be slightly trickier to hear. Those lower ones perhaps than the slightly higher ones, but all still nice low frequencies, okay? Great. See how you go. Ready? Here we go. Good, well done. Okay. Good. A couple more. done. How was that? How did you find hearing the different volumes? Okay, so we're going to do the same again, but on the right-hand side. Ready? Okay, here we go. Good. Well done. Good. Couple more. Great. Last one. Great. Okay, that's that for that ear. I'm going to do the same again with the volume, but in both ears this time, okay? Here we go. Good. Okay. Yep, couple more. Good. Last one. Great. Well done. So how was that, thinking about all those different volumes? Okay, great. What I'm going to do this time is a mixture of both ears, the left ear and the right ear, different volumes, different frequencies. So you'll have to concentrate quite hard on this one. Again, there's absolutely no problem if you miss any, or you're not quite sure if you heard the beep, okay? No pressure at all. We're just seeing where those good levels of hearing kick in, okay? Great. So there will be quite a few of these, and as I say, if you need to take a break or stop, just let me know, okay? Ready? Okay, here we go. Okay. Good. Yes, that's right. Yes. Good. Well done. Yes, that's right. done. Last time. Fantastic. Well done. I'll just pause there for a moment because that was very difficult in terms of having to listen very carefully. So I'll just give those ears a break from the beeps for a moment or two. Is everything still okay? And how is it so far? Surprised by anything? Happy that everything is going in the same? Any frequencies that are tricky for you at all? Okay. Well, what I'd like to do is 2 more tests. The first one is I'd like to play the higher of these low frequencies, so the upper end of the low frequencies, and then finally the lowest of those low frequencies, just to see where those boundaries are. Is that okay? Fantastic. So the upper end of those lower frequencies first, in both ears. Ready? Okay, we go. Good, well done. Yes, that's right. Good. Couple more. Yes. Last one. Yeah, fantastic, well done. So finally, the lower end of those lower frequencies. Absolutely no problem at all if you don't catch all of these, okay? Great. Ready? Okay, here we go. Okay. Okay. Good. Couple more. Good. Last one. Good. Well done. So how was that? The upper end frequencies and the lower frequencies. How were they to listen to? Okay. Well, that's the end of the test. So, shall we take those headphones off? Okay, here we go.
Okay? Great. Just give it a moment for those ears to adjust to not hearing through the computer. Take a look at my notes here. So, is there anything from the beep test that you would like me to add to my notes? So, in terms of the results of that, it's all collated on the computer and we're given a report based on the sounds that you heard. Okay? But is there anything you'd like me to add in at all? Anything that was a surprise? Anything that you weren't sure if you'd heard correctly? Okay, great. So all that leaves us now is a cognitive test. What we'll do is we'll come back to that in a couple of minutes just to give your ears a chance to acclimatise to hearing normal sounds again, and then we can get ready to concentrate just one more time on these last few tests, and then that's you done. So we'll start this again shortly. Okay, so the last of the tests is a cognitive assessment. So what we're going to be doing is testing all sorts of things to do with your thinking and reasoning. So we'll be asking you to do small tasks, remember various things, identify objects and things like that. You happy to go ahead with that? Great. As we go, I'll be giving you lists, showing you pictures and things like that. Any problems, if you need to pause or stop, please just let me know, okay? And this is the last of the tests. Okay, so let's get started. This one, the first one on here, is upside down for me. It's some dice. I think it's upside down so I can show you like this. But what I've done is I've printed it off in a larger format so we can look at it together. And here's what I'd like you to do. So, what we're doing is we're looking at the number, and we are drawing a line to the same number on the dice. Okay, so we have number 1 here, going to number 1 on the dice. So 1 to 1, and then we have number 2 going to number 2 on the dice. So 1 to 2, and so on. And so we're going to complete that up to number 6. Okay, so 1 to 1, 2 to 2. Where next? Okay, 2 to 3. Yeah, where next? Yes. So to there. And where after there? Yeah, to the 4. And after there? Yes, to the 4 on the dice. And where after there? To the number 5, that's right. And after there? Good. To the 5 on the dice. And where after there? Good. Up to that number 6. And finally, good, to the 6 on the dice. So 1 to 1, 2 to 2, to 3 to 3, 4 to 4, 5 to 5, and 6 to 6. Well done, very good. Next, I'm going to give you a list of words, and what you need to do is try to remember them, okay? So what I'll do is I'll read them out, and then we won't talk about them again until I ask you to recall them for me, okay? Great. So it's 5 words. The first word is rose. Okay. The second word is chair. The third word is hand. The fourth word is blue. And the fifth word is spoon. So you have rose, chair, hand, blue, and spoon. I'll be asking you a bit later to remember those for me, so lock those in to the memory. Okay? Great. Next, what I'd like you to do is in 1 minute recall as many fruits as you can. So I'll be scribbling them down as you shout them out. So you have 1 minute, which will start from the first fruit that you name, okay? Okay, when you're ready. Okay. Mm-hmm. Okay. About halfway there. Yep, a few more seconds. And stop there. Well done. That's a lot of fruit. What I'd like you to do is think back to before we were naming fruits and recall those 5 words for me, please, in any order that you like. Yep. Okay, fantastic. We will be revisiting these more times, okay? So keep them in that memory. Next, a little orientation and hopefully nothing too difficult. So could you please tell me, roughly, what time it is, please? And what day of the week is it? What month are we in? And what is the year? Where are we? What building are we in? And where is that building located? Very good. Well done. Next, we're going to have a think about some coins. Okay. Well, coins and notes. So, what I'm looking for is I'm looking for you to pay me 13 dollars or £13. It's entirely up to you which you'd like to use. And you can use any of the notes or coins. Tens and fives for pounds, tens, fives and ones for dollars, and then any of those coins that make up the rest. So, how many ways can you think of to give me 13? You take as long as you need to think about it, that's fine. Let's go for 3 ways to make 13. Okay. That's great. Thank you very much. Next, those words I asked you to remember, again in any order, if you could recall those for me, please. Fantastic, well done. Again, we're not quite done with those yet, so keep remembering them. What I'd like you to do now is give me the category of these things, okay? So if I said, for example, cat and dog, you might say animals or pets or things like that. We're looking for the association between the two. Is that okay? Fantastic. So, the first one is train and boat. What is the association between those two? Thank you. The next is north and south. What category do those belong to, north and south? Fantastic. And the next is drum and flute. What category do those belong to? Fantastic. Right. Those words one more time. If you could recall them first for me. Good. Yep. Yep. Good. Now tell me again, which one is a flower? Good. Which one is a piece of furniture? Good. Which is a utensil? Which is a body part? And which is a colour? Great. Next, I'm going to show you a picture, and it's a lot of items all jumbled up. And I'd like you to tell me what you can see in the picture. So once again, you'll have a minute to answer this for me. I've made the picture slightly larger, so it's easier to see. So we're looking at this top picture here. So you have 60 seconds to tell me everything you can see in that jumbled up picture. Off you go. It's great, you're about halfway there. Ten more seconds. Fantastic. Well done, how was that? Great. So the last time for these things that I asked you to remember, okay? Tell me, did I ask you to name a rose or a daisy or a lily? Did I ask you to remember the colour blue, the colour red or the colour white? Did I ask you to remember a knife, a fork or a spoon? Did I ask you to remember a hand, a foot or a knee? And finally, did I ask you to remember a chair or a table or a bench? Fantastic, well done. You can put those out of your mind now. Well done for hanging on to those. Next, what I'd like you to do is on this page again. There are 4 animals, and all you need to do is name them for me. Identify them, please. So, these 4 here. We'll start with this one. What animals? Fantastic. Well done. Right. Next, what I'd like you to do is I'm going to show you a list of numbers and read them out. There will be various shapes around these numbers, but for this first one, I'd like you to stop me every time there is a number in a circle, okay? So let's give it a go. So, can you see the list of numbers okay? Great, so 1. That's right, well done. 5, 8, good. 3, 9, 2, good. 0, 3. Good. 9. Yes, that's right. 4. Good. 0, 2, 1, 6. Good, well done. 8, 7. Yes, that's right. 4, 6, 7, 5. Good. Well done. We're going to do the same thing again, but this time it's the numbers in circles and the numbers in squares. So stop me on all the numbers in circles and all the numbers in squares. Okay? Great. Lots of numbers this time. So those shapes again, circles and squares. Here we go. So 3, 8. Good. 5, 1, 3. Good. 0, 2. Good. 9. Yes, that's right. 2, 0. Good. 4. Yes. 9. Good. 7, 8. That's right. 6, 1. Good. 5. Yes. 7, 6, 4. 1. Good. 5. Yes. 8, 3, 9. Good. 2, 0, 3, 9. Good. 4. Yes. 0, 2. Good. 1. Yes. 6, 8. Good. 7, 4. Yes. 6, 7. Good. 5. Good, well done. Fantastic. And that is the cognitive assessment complete. Just let me grab the other set of notes. Just pop them on the clipboard and update them. So that is the end of our tests. How was that? I have an enormous report to write up now. What we did was we have a thorough and comprehensive questionnaire from you now regarding your health. We've got some good baseline test results. We looked at those reflexes and they were working well. Your thyroid and lymph nodes. We checked everything was okay in the gastrointestinal area. We did lots of sensation testing. We then checked those eyes. And after that, those ears, a beep test, and then finally a cognitive assessment. Is there anything that you think we have missed? Great. So at this point, I know I've been asking as we've been going along, but do you have anything to add to these notes? Anything to add about the cognitive assessment that we've just done? Were there any surprises in there at all? Okay. And then thinking back to all of these tests, is there anything else you want to add? Anything that has occurred to you as we've been going further on through those tests? Okay. And finally, do you have any questions for me? Anything about any of these tests? Anything about what we did? Anything about the results? Okay. Well, what happens now is we take the results from the questionnaire, we take the results that are written down here, we take the results from the computer, from the beep test, and the results from the cognitive assessment, and we put them together in one big report for you. What we'll do is we'll send that on to your doctor, and we'll send on a copy to you. We'd ask you to have a good thorough look through, to check those results are right, and to also come back to us if there's anything that you're not quite sure of, anything that you think isn't right, or anything you'd like us to look at again. We can revisit these at any time. All you need to do is give us a call, get back in touch, and we'll arrange to get you back in and go over any specific areas of concern for you. Is that okay? Fantastic. Well, thank you so much for your time today. Thank you for your patience, and thank you for giving this fantastic set of results. As I say, the report will be with you very soon, and I look forward to seeing you again soon. Take good care of yourself. Bye-bye.